Hi, I'm Hope, and this is Gabby.
Hi, and today we're going to be going over medication teaching. Hope will be the nurse, and I will be the patient. And we're going to be teaching about fluoxetine. So here we go.
So we're going to start our little scenario.
Okay.
Good morning. How are you, Miss Martinez?
Hi, I guess I've been okay. I really haven't been myself lately. You know, I have a lot of kids, 6 to be exact, and they're all under the age of 15 years old. So I have a lot on my hands. And well, my husband works all the time, and well, Abuela is sick, so I have to do pretty much everything around the house. I just feel like I'm not doing enough, and I feel like I'm kind of losing the will to live. And honestly, if I were gone, I just kind of think my family would be okay without me. So...
Well, it seems as if you're having a pretty hard time right now. I'm here to go over your antidepressant medications that have been prescribed for you.
Oh, okay, yeah. I have several questions about that medication, because I've never taken it before.
Well, I'm here to answer all the questions that you have. We're going to start with the basics, so you understand why you're taking this medication. So the drug is called Fluoxetine or Prozac, and this is an SSRI, so it's a selective serotonin reuptake inhibitor. And this drug will help reduce your depression and the hopeless feelings that you're having.
That sounds really good. I have to confess, though, in the past, I haven't been very good at taking my pills. Just, because in the morning my kids are so busy and I have to do all that stuff for them and Abuela, so sometimes I forget. What should I do if I miss a dose in the morning?
Well, the pill should be taken daily, and it even says that on the pill box.
Oh,
so
yeah.
You can read that to remind you.
Okay.
But if you do miss a pill, you should take it as soon as you remember. So say you don't remember to take it right as you wake up, you can take it after taking care of the children in the morning. And then if you forget completely, don't take 2 the next time that you do take the medication. Have you considered a pill organizer? This might be really helpful for you.
Oh my gosh! I have never even seen those things before. What are they?
Well, it has all the days of the week on it, and you can put the pills in there, and it really can help you stay organized and remember to take them each day.
Oh my gosh. I'm definitely going to get one of those. I really like to stay organized, so I think that'll help me a lot.
That's good, yeah.
Yeah.
You can have this one.
Really?
Yeah.
Oh, sweet. Thank you. So another question I have. A lot of the times when I wake up in the morning, I have a very upset stomach, and sometimes when I first eat, I have some, acid issues up in my throat and stuff. So is there anything I can do to make sure this pill won't make it worse or to stop it from happening?
This is actually a common side effect of this medication, and a lot of patients have said that if they take it with breakfast, they take it with food in the morning, it will reduce that stomach ache or acid reflux feeling.
Oh, good. Okay, that's good to know. And another thing, I really like enjoying my herbal tea in the morning, and that's the one time of the day that I do get to sit down. Do you think I could mix the contents of the pill into the herbal tea so I don't have to swallow it?
Well, this pill shouldn't be opened at all or crushed, as it won't work as well in your body. But you said you use herbal teas. Have you talked to your healthcare provider about that?
Oh, yeah. I tell the doctor about all the herbs my curandera prescribes me, and he said they were all fine to take with the medicine, so it's okay.
That's really good to hear. Now let's talk about some side effects that you might have. So when you first start taking this medication, you might feel a burst of energy. And that's why we recommend that you take this in the morning, because it could interfere with how well you'll sleep at nighttime. You might also experience headaches, mild anxiety, sweating, and dry mouth.
Okay. I think I've had dry mouth before. What really helps relieve it and make me feel better?
Well, you can try taking some sips of water throughout the day, and also make sure that you keep good oral hygiene.
Okay, that sounds good. I've been thinking about it a little too. Will this pill have any effect on the relationship that my husband and I have?
Well, some people have said that it could decrease their interest in having sex, and it's also possible that this might not affect that at all. But do you have any plans of getting pregnant at all, or are you pregnant at the moment?
I'm not pregnant at the moment, no, but We do believe that it is God's plan to determine the size of our family, so, I'm not sure, but I'm pretty happy right now with my family, so hopefully it'll stay that way.
All right. This drug can be dangerous for your baby if you're breastfeeding or you become pregnant, so make sure you just stay in contact with your healthcare provider and let them know if you're considering having another child or you think you become pregnant.
Okay, I sure will. Are there any other really bad side effects that I should watch out for?
Well, if you start wanting to hurt yourself at all, you should report this to your doctor. It's possible that the medication might build up in your system and become toxic to you. So let me just list a couple side effects that if you start to feel them, you should report to your healthcare provider. So
okay.
If you have any severe headaches and severe sweating, increased sweating more than the normal, fever, high blood pressure, you're pale, you're feeling tired, you have stiff muscles, or you start to see things, you're hallucinating, you're seeing things that aren't there.
Yes, okay.
And you have severe nausea and vomiting. You should definitely alert your healthcare provider of this.
Oh my goodness. Nurse, this is a lot of information to take in. I don't think I'm going to be able to remember all this stuff.
Well, lucky for you, I actually saw on your chart that you're bilingual. You also speak Spanish, so I printed out all the information that we've been talking about today. So all the side effects and all the things to remember. So you can take this home with you today.
Thank you so much. This is very helpful to me. And you also said, just one more thing that I'm thinking about. You said the pill might make me kind of tired.
Yeah.
Well, will I be still able to drive? Because I need to get my children to school every day.
Well, it can cause drowsiness, which could impair your ability to drive. But when you first take the medication, for the first couple days, just feel it out, see how you're feeling. If you feel like your normal self, then you're fine to drive your children.
Great. That's awesome. When will I really start to feel better and like myself again?
You'll start to notice an improvement in the first 2 to 3 weeks after taking this medication. And the first signs you'll notice is that increased energy level, like I said previously.
Okay.
But please be patient, though, because the full effects might not be present until around 7 to 8 weeks.
Okay. I just really want to be the best mom I can be. And right now it just kind of feels like I'm a failure and they don't really appreciate anything I do for them.
Well, I appreciate your courage and thank you for sharing with me. It seems that talking to someone might be really helpful to you. Has your healthcare provider given you any therapists in this area?
Oh, I said no to all of his therapists. I have this person that I see. He's called a consejero back home. And every week I go visit him to help guide my life and how God gives me blessings each and every day. So I definitely have someone to talk to.
Well, that's good that you're talking to someone. Do you have any more questions for me, Miss Martinez?
No, nurse, you have been so helpful, and I feel like I'm ready to take this medication.
Well, I'm glad. And if you have any questions at all, please feel free to ask any questions or if you have any concerns, because we're here for you and we want to help you.
I sure will. Thank you.